Hi, this is Jackie from Hardcore Gorgeous Hormones, and today I'm going to show you how to mix the step-up kit. So that's if your kit is starting at 1 milligram, not a beginning dose, okay? So we're going to mix 1 milliliter of bacteriostatic water into the 4 milligram vial of semaglutide. Okay, first thing, I wish my camera was down. Anyway, I'm mixing this, doing this really fast because I didn't have it. Okay, so you take the cap off the bacteriostatic water, twist a little bit, and the cap off the semaglutide. It wants to rip. Okay, it ripped a little bit. It came off. It's fine. Okay, so you're going to wipe it with rubbing alcohol, isopropyl alcohol. Okay. You will have taken your 1 milliliter mixing syringe out of the wrapper and then crank the cap on so that way the needle will stay on. Okay, here's your needle. First thing is you're going to put it into the center of the rubber stopper, and you're going to pull 1 milliliter of air out of the little vial. You can go past the 100, it's fine. Give it some time to actually fill up. So right now you're making room for the water to go in there. Okay, now you're going to push that air into the bacteriostatic water. Go kind of slow so you don't make bubbles. Okay. If you're having a hard time getting the water out, you can pull out the syringe and push another bunch of air in there. The air going in helps it come out easier. Okay, so you're going to pull it all the way back to the 100. That's 100 units, which equals 1 milliliter. See if you have any air bubbles. I have some air bubbles. So you can push it back in and then pull it down again. If you have the air at the top, push it in, pull it out, push it in, pull it out until it's filled all the way to the top. Okay, then tip it over, and you're going to have the tip of the needle in the air of the vial, and then pull it out. You have a lot less chance to get like water spewing all over the place. Okay, next, you're just putting the water right into the vial of the semaglutide, which is different than HCG. HCG, you have to remove it. It's not big enough. But this is big enough for mixing directly and storing directly into the semaglutide vial. Okay. Now, sometimes the semaglutide stays solid. Usually I've mixed the day before, especially tirzepatide. That doesn't like to dissolve that easily anyway, so that is your mixed semaglutide. It's right in there. Whenever you mix it, you never want to shake it. You have to be really gentle. So before you fill your syringes, you can go up and down real gently. Okay, now I'm going to show you how to fill a syringe. Okay? You take the bottom cap off, take the needle cap off, pull back the syringe so it's filled with air. You're going to push that into the center of the cap again. And if you're starting your dose at 1 milligram, that's 1/4 of the water that you put in there, 1/4 of the semaglutide. You're going to tip it upside down, and you're going to pull the syringe back. You did push the air into the vial first, right? Okay, so you're filling it to, if you can see it, the 25 mark, or midway between 20 and 30. That is 25 units, and that equals your beginning dose of 1 milligram. For the rest of the doses, it's all written in the step up section of your written directions. If this is cold, you can just rub it in your hands. You can stick it in your little boobs or your big boobs. Use the alcohol swab to swab whatever part of your body you want to do it. You can do it in your belly fat, your hip fat, your buttocks, your any fat on your thighs. You can pinch your arm and do it there. If you have nausea, 1 week, switch the place you injected. Anecdotally, they say that helps. I'm not sure because I haven't really had nausea like that. But so that's your mixed 4 milligram vial of semaglutide with 1 milliliter or 100 units of water. This is your little skinny syringe. Okay, I'm going to stop talking now. Thank you. Enjoy it. Please tell me how you're doing and read your paperwork. Okay.